Let's talk about Medicare Advantage. I hear a lot of people talk about why you shouldn't go on Medicare Advantage, why you should. You know what? I think it's personal. I think it's really a personal decision on whether you want to do it or not. Now, I think that there are limitations. There are definitely limitations. Yeah, you can go and see those advertisements, Joe Namath on TV saying you can get your $175 back. You can go for those things. Those are benefits that a lot of Medicare Advantage plans have. Now, maybe not to the numbers that Joe is saying on TV, but you can go for those benefits. Now, there are some things that you're giving up, and I'm going to go over a few things that you're giving up. Number one, you're going to need to work with a network. If you're on an HMO plan, you have to stay in that network, or else you're not going to get any coverage at all. If you're on a PPO plan, okay, you can go out of network if you choose to, but you're going to pay a lot more for your health care. Now, you get all those extra shiny benefits like the dental, the vision, the hearing, the Part B give back, and transportation. For some, transportation is important. I have a lot of clients who need it. And I'm not saying it's wrong to go with Medicare Advantage. What I'm saying is consider what you're giving up. Because on the Medicare supplement side, what you're looking at is original Medicare. And when it comes to billing, it's also very easy when it comes to billing on the supplement and original Medicare. You're talking about prior authorizations, almost non-existent. There are a few things you do need to get prior authorizations for, but it's almost non-existent. Now, if you get, let's say, a Plan G, you pay a premium, and then $240 is your deductible for 2024, and that's it on your medical. You're done. That's it. You can go to any doctor that accepts Medicare in the entire country. Now, I would say for some that works. For others, it doesn't. Consider your budget. Consider what you want as far as your health care, and also consider what's going to get you to what you want in retirement as well. Some people don't want to care about all those copays, and they don't want to worry about it. They want to pay a 1 monthly premium, be done with it, be able to go to the doctor whenever they feel like they're sick or they want to go see a doctor. Go original Medicare in that case. If you're on the other side and you want to look at those other options, you're okay with copays, you're okay with prior authorizations, you're okay with those things, Medicare Advantage can get you those benefits that original Medicare doesn't have. But consider the limitations on both. Each side has limitations that others don't. Don't listen to anybody, an insurance agent, tell you to go one or the other. Consider both options, because we can say the same thing about both plans to two people who are in very similar situations, and it's very likely they're going to choose two different options just because they want different things in life than each other. So look at both options. In some areas, let's say if you live in a rural county area, definitely I really kind of encourage people to look at Medicare supplements before Medicare Advantage, but I wouldn't discount the Medicare Advantage. But the same thing that would happen in a large metro city. There's a lot of quote unquote good Medicare Advantage, but don't discount the supplements, because you're giving up some things when you go on a Medicare Advantage plan as well. So my point is, look at both options. Don't just rely on one because somebody told you. Look at both options out there. Do your research. I'm a Medicare agent, and I just met a client. It was an amazing appointment. He had done so much research ahead of time. He figured out what he wanted. It should be done to what you want and nobody else. Like, follow, comment below if you want to know more. Please comment below, and I can talk to you about what you're wanting to hear about. All right, bye.